The next major body system to analyze is the nervous system. The nervous system is broken down into two primary components. The first is the central nervous system, which includes the brain and spinal cord. Everything else branches off from the central nervous system and is a part of the peripheral nervous system. Within the peripheral nervous system are sensory and motor nerves that help the body interact with its environment. Our nervous system performs several vital functions for the body. The first is referred to as autonomic control or response. These are the things our bodies do without any conscious thought. We do not need to think to breathe or to blink our eyes, for instance. This is all automatic. This autonomic control is integral in the body's fight or flight and feed or breed responses with the sympathetic and parasympathetic nervous systems, which we will be discussing in a few moments. The central nervous system is the center of our consciousness, our thoughts, personality, and essential being. Located within the brain are areas for logic, language, intuition, reasoning, and analytic thought, to name a few. This is why brain injury from trauma, a stroke, or some other disease process can be so debilitating, as such injury has the potential to strike at the very core of the person's own identity and abilities. Within our consciousness is also something called the reticular activating system, which is responsible for regulating our sleep-wake cycle and also plays a part in transitioning between periods of conscious relaxation and heightened attention. While not an all-inclusive list, the reticular activating system is a complex mechanism that has been linked to schizophrenia, narcolepsy, depression, autism, Alzheimer's, Parkinson's, attention deficit, and post-traumatic stress pathologies. The nervous system allows us to receive feedback from the environment in which we live through the body's senses of hearing, smell, taste, sight, and touch. Sensations of both pleasure and pain have cursory effects on the other parts of the central nervous system, which can trigger the sympathetic or parasympathetic nervous systems, impact our consciousness, and provoke an involuntary motor response, which just so happens to be the last function of the nervous system that needs to be identified. Motor function, that is, the flexion or relaxation of skeletal muscles to produce movement, is a function of our nervous system as well. While these functions are listed separately, they are all related and, in many instances, interdependent. Sensory inputs such as an alarm clock can trigger the reticular activating system to wake us from sleep. During that process, the person may consciously decide to stretch, thus triggering a motor response. When the person realizes that she hit the snooze button once too many times, there is a sympathetic response when she realizes she is late for work. Within a few moments, however, she realizes it's a Saturday and the alarm should not have been on in the first place, triggering the parasympathetic nervous system and, if she's lucky, the reticular activating system that allows her to grab an extra hour of sleep. To understand how the nervous system performs autonomic functions, it is important to have familiarity with the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is responsible for what is known as the fight or flight reaction. It is a system that kicks in when we are threatened or when we need to be aggressive. Stated another way, this is the system that helps our bodies respond to stress. It is a system responsible for that jolt you feel when you narrowly miss being in a car accident, go bungee jumping, or become involved in an altercation. This response is designed to heighten our senses and improve the ability to respond for the sake of preserving ourselves. This is a primal response that does not even involve the brain. In simple terms, this is the body's gas pedal. Push it and the engine revs up. At the EMT level, it is not necessary to know the fine intricacies of how the sympathetic nervous system works. On a simplistic level, our body receives feedback from the environment that activates neurons in the spinal cord within the T1 to L2 region. These signals proceed through bundles of nerves, known as ganglia, to various target organs. Of great importance is the effect on the endocrine system. The sympathetic nervous system directly stimulates the adrenal medulla in the adrenal gland located on top of the kidneys. This causes the release of hormones, norepinephrine and epinephrine, into the circulatory system. Where the nerves of the sympathetic nervous system do not reach, the hormones do, and these hormones have a direct impact on our circulatory and respiratory systems. When active, the sympathetic nervous system recognizes the need for the body to respond quickly. As a result, blood flow is increased to vital organs and decreased to those that are less vital to immediate survival. Our eyes dilate to receive more light. Our heart rate increases to move more blood and subsequently more oxygen to our muscles. The bronchi relax to allow for greater air exchange into and out of our lungs. And liver converts an increased level of glycogen to glucose to supply additional sugar to the brain and active muscles. Inversely, the digestive and renal systems slow down substantially. The last thing you need to do when fighting or running for your life, so to speak, is stop for a bathroom break. If we called the sympathetic nervous system the body's gas pedal, the parasympathetic nervous system would be the brake. This is a system that turns off the sympathetic nervous system. It is also the system that works to regulate vegetative functions such as maintaining a normal heart rate or blood pressure. Because this system slows us down, so to speak, it is often referred to as the feed or breed system. While we have not talked in great detail about how nerves function, it is important to know that chemicals are used as neurotransmitters to transmit messages from nerve cell to nerve cell. In the case of the sympathetic nervous system, those chemicals are norepinephrine and epinephrine. In the parasympathetic nervous system, however, the chemical used as a neurotransmitter is acetylcholine. When activated, impulses originating from the brainstem and the neurons in the S2 to S4 spinal cord travel throughout the parasympathetic nerve fibers, using acetylcholine as a neurotransmitter to facilitate the processing of food, energy absorption, relaxation, and reproduction. The effect is obviously quite the opposite of the sympathetic nervous system. With the parasympathetic nervous system in control, our heart rate slows, blood pressure is reduced, pupils constrict, and digestive system activity increases. Thus far, every body system discussed has been labeled as important or integral to our body's functioning, and the nervous system is no exception. Our next body system is the integumentary system, which is ultimately a very fancy way of describing our skin. Our skin is actually considered to be an organ, and it is the largest organ in, or arguably on, our bodies. The skin is comprised of three major layers. The first is the outermost, called the epidermis. The skin cells within the epidermis divide rapidly, resulting in the movement of skin cells up, away from the body. As the cells progress away from the skin's blood supply, those cells die and are eventually shed away from the body. Believe it or not, the skin we see with our eyes are actually dead skin cells that will soon, within 2 to 4 weeks, be washed or brushed away to be replaced by other dying cells. This process helps protect the body against bacterial infection as the outermost skin layer is constantly moving cells out away from the body. Note that there are no nerves or vasculature within the epidermis. The prefix epi is derived from a Greek preposition meaning on, above, or over. Thus it makes sense that the epidermis sits above the dermis, the skin's second major layer. The dermis is far more busy, if you will, than the epidermis. Within the dermis are blood vessels, nerve endings, glands, and other structures. Given the existence of these structures, injuries exposing the dermis can lead to significant bleeding, intense pain, and infection. It is within the dermis that our bodies will begin an assault on foreign materials, including organisms and damaged cells, with the white blood cells within our immune system. It is also the area where platelets within the circulatory system will work to repair damage to the skin, such as cuts and abrasions. The dermis is also the layer that experiences the most degradation over time. As we age, our glands produce less sweat and natural oils, thus drying out the skin. Then some of the vasculature within the dermis is lost, and the skin becomes thinner and more prone to injury. The innermost layer of the skin is called the subcutaneous layer. This layer contains fatty, also called adipose, and soft tissue. It too is rich in blood supply, nerves, and other structures just like the dermis. Injuries that extend down to the subcutaneous skin layer, or beyond for that matter, are prone to infection, are associated with significant pain, and can generate a great deal of bleeding. If not evident thus far, one of the primary purposes of the skin is to protect the body from infection. The skin is a protective envelope for our bodies. It is our first line of defense against bacteria, viruses, foreign bodies, and other microorganisms that would harm us. Additionally, the skin serves a significant role in regulating the body's temperature. The subcutaneous layer provides a great deal of insulation. Heat passes through this layer of the skin 3 times slower than it does through muscle or the other layers of the skin, which helps conserve body heat. The sweat glands within the skin also help cool the body through the evaporative process. The evaporation of sweat on the skin helps cool the body. While arguably not an essential function, the skin also serves as the basis for what we consider to be appealing or beautiful. Unfortunately for some, the skin can also be the basis for bias and prejudice given ethnic variations in skin pigmentation and other features. Because sight is such an important sense for human beings, our skin is one of the first things people notice about us. It presents us to the world. As an EMS student, you will eventually learn how to form an initial impression on your patient's condition based in part upon how the patient's skin looks. Next on our list is the digestive system. The purpose of the digestive system is pretty simple. It supplies our bodies with nutrients. We consume food and drink. The digestive system absorbs fats, proteins, carbohydrates, vitamins, minerals, and other nutrients, and it dispels of the waste. Food and beverages enter the body through the mouth and oral cavity. Processing of our food begins right away as we chew the food, which is mixed with saliva. As we swallow, our food and drink hopefully bypass the trachea, which leads to the lungs, and enters the esophagus, a smooth muscle tube that carries food down into a hollow organ known as the stomach. The environment within the stomach is not a pleasant one. Protected by a layer of mucus, the stomach mixes our food with hydrochloric acid and enzymes to produce a thick fluid called chyme. While we are discussing the stomach, please take note of its location within the body. The stomach lies in the upper left abdominal quadrant. This is important because patients will often complain of stomach pain when the pain is located somewhere else in their abdomen, nowhere near the stomach. From the stomach, the chyme is passed through a tube called the duodenum before it finds its way into the bowels. While in the duodenum, chyme is mixed with bile, which is produced by the liver and stored in the gallbladder, and pancreatic digestive juices. These substances help the body break down the food even further, while also increasing the pH of the chyme so that it is less acidic. Once in the small intestines, the nutrients contained within the food are absorbed through the intestinal wall into the bloodstream, where a pass is made through the liver to detoxify the blood before distribution through the remainder of the circulatory system. Thus, the liver not only produces bile to assist in digestion, but it also serves as a filter for the blood, removing toxins, such as alcohol, that enter through the digestive process. The liver also removes damaged red blood cells from our systems, which are then used to make bile. After the small intestines are the large intestines. During this part of the journey, bacterial, intestinal flora as they are sometimes called, assist in releasing vitamins and fluid while the bowel absorbs that fluid back into the bloodstream. Anything left over becomes waste product, stool or feces, that is passed outside the body through the rectum and anus during excretion, defecation. One additional structure in the digestive system with which an EMT must be familiar is the appendix, or variform appendix if you want to be proper. Located in the lower right quadrant, the appendix is believed to have served an evolutionary purpose that no longer exists by housing bacteria that broke down cellulose molecules found in plants. Whether or not that is the actual case is irrelevant when a patient is complaining of abdominal pain in that area, as appendicitis can prove to be a significant medical emergency. That will be discussed more in a later module, though. As you may have noticed, some of our organs are considered to be parts of multiple body systems. The lungs are respiratory, but they also have a circulatory component. Our oral cavity is used by both the respiratory and digestive systems. If there is one system in particular that seems to have numerous organs that also serve a role in another system, it would be the endocrine system. The endocrine system is a system that regulates bodily functions through the use of chemicals called hormones. We have many organs, usually called glands, responsible for producing these hormones. The testes and ovaries, collectively referred to as gonads, regulate the male and female reproductive systems respectively. The pancreas regulates our blood sugar and will be discussed in greater depth in just a bit. We have some familiarity with the adrenal glands as they work with the sympathetic nervous system. They also serve a role in regulating water and electrolyte levels within the body. The thymus gland is integral in the development of our immune system. The thyroid, medial, and parathyroid lateral glands regulate metabolic rate and blood calcium levels. The pineal gland regulates our body's internal clock, known as our circadian clock or circadian rhythm. The pituitary gland, though small, about the size of a pea, is powerful in that it governs some of the functions of many other glands. It also regulates or impacts our growth, metabolism, blood pressure, reproductive organs, water balance, and thyroid gland function, to name a few. As EMS providers, there are a few organs in the endocrine system that are of particular importance. The first such organ is the pancreas. Located posterior to the stomach, resting superior to the bowels, the pancreas is important because it plays a very important role in the regulation of blood sugar. As we will discuss in a few slides, sugar is vital to the proper functioning of our cells and, thus, our bodies. The pancreas works in regulating our blood sugar by producing two critical hormones, glucagon and insulin. Glucagon is a hormone responsible for breaking down glycogen, a complex carbohydrate, into a simpler form of sugar or glucose. By breaking glycogen down into individual glucose molecules, glucagon increases the blood sugar concentration within the bloodstream. Because the liver is the largest and heaviest organ in the body, and an average liver can store 5 to 8% of its weight as glycogen, a lot of the work being done by glucagon is in the liver. In addition to breaking down glycogen into glucose, glucagon also stimulates the liver into breaking down proteins and fats into glucose as well. One of the skills you will be learning as an EMT is how to administer glucagon to a person suffering from hypoglycemia, low blood sugar. In administering this medication, the EMT is hoping to raise the patient's blood sugar by converting stored glycogen in the liver into glucose. In addition to increasing blood sugar concentration through the release of glucagon, the pancreas also produces a hormone called insulin that is responsible for lowering a person's blood sugar. Imagine for a minute that your cells have little doorways in their membrane walls that allow sugar to pass into the cell. Insulin is essentially the key for those doors. When introduced into the bloodstream, insulin increases the uptake of glucose into our cells, thus resulting in a decrease of the concentration of glucose within the bloodstream. Insulin also promotes the creation of glycogen, protein, and fat to store energy within the body. You will delve into greater detail regarding diabetic emergencies and complications later within this course. While already discussed as part of the sympathetic nervous system, the adrenal glands deserve special recognition within this endocrine system discussion, given their importance in the functioning of the sympathetic nervous system by the production of the hormones norepinephrine and epinephrine. As a quick refresher, norepinephrine and epinephrine are neurotransmitters that engage the sympathetic nervous system. These hormones are released from presynaptic cells for activation of receptors in postsynaptic cells. Within the lungs, norepinephrine and epinephrine activate what are known as beta 2 receptors in the lungs that stimulate the bronchioles to dilate, thus allowing more air into the lungs themselves. The receptor sites in the heart are called alpha 1 receptors. When activated by norepinephrine and epinephrine, the alpha 1 receptors in the heart increase the heart rate and the force of contraction, which results in more blood and, by extension, more oxygen being moved around the body to fuel our organs for that ever so vital fight or flight response. The renal system is also called the urinary system, comprised of four primary structures: the kidneys, ureters, bladder, and urethra. The renal system is designed to primarily regulate fluid and electrolyte levels in the body, filter chemicals from our bloodstream, and also maintain the acid-base balance within the body. An average adult will excrete 1.5 liters of urine per day. If a person is dehydrated, the renal system will compensate by retaining fluid, thus reducing the frequency of urination and quantity of urine expelled. Inversely, what happens when you drink a lot of fluids over a short period of time? The renal system increases urine production, resulting in more frequent urination. The kidneys manage this by regulating the flow of electrolytes such as sodium, salt, bicarbonate, potassium, hydrogen, and chloride. In managing hydrogen in particular, the kidneys help to ensure a proper acid-base balance within the body. For lack of a better term, the kidneys serve as filters for our bloodstream. The kidneys filter all the blood in our circulatory system approximately 60 times a day, which makes them very efficient at removing waste products in the blood. These waste products are commonly a substance called urea, which is a substance responsible for giving urine its yellow color. The kidneys are also responsible for removing other toxins, including drug metabolites, which is why individuals on certain prescription medications must have their kidney function monitored routinely to ensure the kidneys are not being damaged by the medication. The renal system also helps to manage our blood sugar by excreting glucose in our urine if the concentration of glucose in the blood exceeds a certain threshold, and it even plays a part in regulating our blood pressure by controlling the fluid levels within the body and releasing an enzyme called renin that ultimately results in elevating our blood pressure. If it is not already evident, the urethra is shorter in women than in men, given that it must pass through the male penis. As a result, women are much more susceptible to bladder and urinary tract infections than men. The last body system we need to cover is the reproductive system. By its very name, it should be evident that the main purpose of the reproductive system is reproduction, the making of babies to ensure the survival of the species. The reproductive system also serves an additional purpose by producing hormones that affect our emotions, mood, and physical development. Ovaries in females produce estrogen, which is essential in the development of secondary sexual characteristics such as breasts and the regulation of the menstrual cycle. Estrogen can also accelerate the metabolism, increase fat stores, and increase bone formation. Men also have low levels of estrogen in their bodies compared to women, given some production in the liver and adrenal glands, which serves various functions related to the male reproductive system. In men, the testes produce testosterone, which is vital to the development of male reproductive organs. Testosterone also contributes to increasing muscle mass, bone mass, and the growth of hair. Women also have low levels of testosterone in their system, approximately 7 to 8 times less than men, given some production in the ovaries and adrenal glands. Lastly, given the inclusion of the urethra, part of the renal system, within the penis, a reproductive organ, the male reproductive system is also involved in the process of urination. As the reproductive systems vary between men and women, we will look at each independently. Beginning with the female reproductive system, we will first identify the ovaries. These are the female sex glands. They produce the hormones estrogen and progesterone. They are also responsible for the development and release of eggs for reproduction. The fallopian tubes, also called uterine tubes, are thin, flexible tubes that extend from the ovaries to the uterus. The purpose of these tubes is to deliver the eggs produced in the ovaries to the uterus. If fertilization of an egg occurs, it usually does so while the egg is still in the fallopian tube. If the fertilized egg fails to move down into the uterus, an ectopic pregnancy will result. This is a significant medical emergency that will be discussed in greater depth later in this course. The uterus is where fetal development occurs. It is a hollow, thick-walled, muscular organ superior to the vagina. The vagina is located just below the uterus and serves several purposes. It receives a penis during intercourse. It provides a route for the discharge of menstrual blood and tissues, and it is also called the birth canal as it is the final passageway from the uterus to the outside world for a baby during delivery. Lastly are the external genitalia. Structures such as the perineum, mons pubis, labia, and clitoris protect the opening of the vagina and serve a role in sexual functioning. While not absolutely essential in the process of reproduction, female breasts are commonly included within the reproductive system as they do assist in the reproductive process by producing stimulus to both the male and female in varying degrees during the reproductive process. The breasts also contain mammary glands that provide breast milk, nourishment to newborns and infants. As women age, ovarian function diminishes, menstrual periods cease, external genitalia, the labia and clitoris, become smaller, the vagina narrows and shortens, the lining of the vagina becomes thinner and dry, and the ovaries and uterus decrease in size. By comparison, the male carries his sex glands, his testes, on the outside of his body within a muscular sac known as the scrotum. The testes produce hormones and, most importantly to reproduction, sperm. Sperm produced in the testes is stored in the epididymis until needed. During intercourse, sperm moves from the epididymis through a tube called the vas deferens to an area in the prostate gland where the sperm is combined with seminal fluid to produce semen. The semen is then routed into the urethra located within the penis for ejaculation. The penis itself is a spongy organ that, when engorged with blood, becomes erect. As you may notice from the diagram, the urethra passes from the bladder through the prostate gland before entering the penis. As a result, an enlarged prostate can lead to urinary problems in men, which typically become more common with age. Along those lines, Men also experience a reduction in the size of their penis and their testes hang lower in the scrotum as they age. This presentation was created by Waukesha County Technical College with grant funding from the Wisconsin Technical College System.